Welcome to your guide to healing after an extraction. Healing takes time, and every patient heals a little differently. We'd like to walk you through what to expect and share a few simple ways to support a smooth recovery. It's normal to experience some discomfort, swelling, and minor bleeding after an extraction. Healing occurs in stages, and while every patient heals a little differently, gradual improvement is what we expect to see over time. During the first day, a blood clot forms within the extraction site. This clot protects the area and provides the foundation for healing. Mild bleeding and oozing during this period is completely normal. Over the next few days, swelling and discomfort often reach their peak before gradually beginning to improve. During this time, your body starts replacing the blood clot with healthy healing tissue. By the end of the first week, the extraction site may appear white or yellow in certain areas. This is a normal part of healing and does not necessarily indicate infection. Most patients also begin noticing an improvement in swelling and tenderness around this time. Over the following few weeks, the socket continues filling with new connective tissue from the base upward, while the gum tissue gradually covers more of the opening. Many patients notice a significant improvement in comfort during this stage. Over the next 1 to 2 months, early bone begins forming within the socket. While the gums may appear largely healed from the outside, deeper healing is still taking place beneath the surface. Over the coming months, the extraction site continues to fill with new bone, which gradually becomes stronger and more organized. Bone remodeling and maturation continue for many months afterwards, and subtle changes may continue for a year or longer. Although the gums may appear healed within a few weeks, the deeper tissues continue healing for many months. The extraction site gradually fills from the bottom upward as new bone develops and matures. Healing looks a little different for everyone. Factors such as the complexity of your procedure, your overall health, medications, genetics, smoking status, and how closely post-operative instructions are followed can influence healing. Light bleeding and oozing from the extraction site is a normal part of healing early on. If the bleeding becomes heavier, place the sterilized gauze provided directly over the extraction site and bite down firmly for 30 minutes without checking the area. If the bleeding continues, some patients find it helpful to dampen a black tea bag with water, place it over the extraction site, and bite down firmly for another 30 minutes. Black tea contains natural compounds that may help support clot formation. Some soreness is expected as the area heals. Taking the medications for you can help keep you comfortable during the first few days. If we've recommended alternating Advil and Tylenol, continue following the schedule provided to you. Staying ahead of discomfort is often easier than trying to catch up to it once symptoms have become more intense. Measure out half a teaspoon of table salt in a standard glass of warm water. Beginning the day after your extraction, gently rinse with warm salt water several times a day, especially after meals. There is no need to forcefully swish. Continue brushing and flossing the rest of your mouth as usual. Keeping your mouth clean helps support healthy healing. Avoid brushing directly over the extraction site. It's not necessary. If you've been given a syringe, begin using it as directed. Gently flushing the area helps prevent food and debris from collecting while the site continues to heal. Please contact our team if bleeding, pain, or swelling continues to worsen rather than gradually improve. You should also reach out if you develop a fever, have difficulty swallowing or breathing, or if something simply doesn't feel right. Healing looks a little different for everyone. If you have any questions at any point during your recovery, we're here to help. This video is intended for general educational purposes only and does not replace individualized medical or dental advice. If your healthcare provider has given you specific post-operative instructions, those instructions should always take precedence.
Visit www.auscadental.com for downloads and to book online. We look forward to seeing you at your next appointment.